Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We are a health system with 3 academic medical centers. IAMC status means we have our finger on the pulse of the latest treatment and technologies in medicine, and we're bringing it right to our community. I'm your host, Dr. Toni Flowers, Corporate Chief Opportunity and Social Responsibility Officer. Today, we will be joined by Dr. Robin McGoey, our Corporate Chief Academic Officer, and today we'll discuss all our academic partnerships and initiatives. Dr. McGoey, thank you so much for joining us today. To start, first, would you please tell us a little bit about yourself and how you came to be here at LCMC Health?
Well, thank you for having me today. I'm very excited to be here. So I am a LSU trained physician, former faculty member, and residency program director. And then in 2017, had the privilege of being selected by University Medical Center as their chief academic officer. And then as LCMC Health's academic footprint grew and expanded, it was only natural that this role would evolve into a corporate or system role. And so in 2020, I had the honor of moving up to the system. And at the system level or the corporate CAO level, I, with the team, the academic affairs team, we oversee the academic operations and the clinical learning environment at all 8 of our facilities.
That's amazing. We're so glad to have you.
I'd like
to start with discussing our two major academic
LSU
partners,
Health and
LSU
Tulane
Health
School of
and
Medicine,
Tulane
and our
School of
academic
Medicine,
medical centers.
and our
What do these
academic medical
partnerships mean
centers.
for our system
What do these
and
partnerships
our
mean to our
hospitals?
system
What
and our
benefits do these
hospitals?
type of
And
relationships
also,
bring
what
to
are the
things like
benefits of these types of
research and clinical
relationships?
trials?
What does they bring to the hospital or the health system where we look at clinical trials and research, things like that?
Well, you are right. LSU and Tulane are our most substantial academic partners. These relationships are foundational to our mission to provide health care and education beyond extraordinary. Really, we're an academic health system comprised of 3 major teaching hospitals, University Medical Center, East Jefferson, and then Manning Family Children's Hospital. But all 8 of our sites host and train learners in all kinds of healthcare professions. With LSU, our relationship extends beyond the School of Medicine into their nursing program, allied health, as well as the dental school. And then with Tulane, beyond their School of Medicine, we're really excited about our recent partnership to support their accelerated Bachelor of Nursing program as well. In terms of physician pipeline with the 2 schools, we host here at LCMC over 105 different residency and fellowship programs in more than 70 different specialty areas.
It is so amazing.
It is amazing. It's a big footprint. And so really together with LSU and Tulane, we're building a sustainable and strong pipeline of featured positions, not just for LCMC, but for the state at large.
That is awesome. So building off that, how do these partnerships help us to boost patient care?
Well, academic medicine just really equates to better health. Honestly, it ensures our patients have access to the leading edge of medicine, to the latest evidence-based clinical practices, to top clinical specialists that work in multidisciplinary teams to provide coordinated care to even the most complicated of patients. It also fosters, academic medicine also fosters a culture of inquiry, as you mentioned previously. So groundbreaking clinical research with the 2 schools and others, clinical trials, as well as novel technologies. So academic medicine really does equate to better health.
That makes so much sense. You mentioned that we had other partnerships outside of those major medical schools. Can you talk about those other educational institutions and how they're helping to create this pipeline of healthcare professionals?
Absolutely. So we have a broad and vast network of educational or academic partners. Extends into probably hundreds of different agreements with various schools of education across the country, honestly. Through those collaborations, we're building healthcare professions in nursing, radiology technology, pharmacy, surgical technology, rad tech, sterile processing, and many, many others. Locally in the Louisiana area, I would say our most expansive relationships are probably with Delgado, University of Holy Cross, Loyola, Xavier, SUNO, Chamberlain University, and of course, as we've mentioned many times, LSU and Tulane. But those are just to name a few.
So, normally when we think about healthcare, we think about physicians and nurses. But talk to us about this PharmD residency program.
Yeah, great question. So there's definitely growing recognition for the value of the clinical pharmacist on the healthcare team. And so in response to that, LCMC does support 1 to 2 year programs in postgraduate advanced pharmacy residencies. 4 of our sites host those learners, and that's University Medical Center, EJ, Manning Family, and also Toro. This program with their faculty really ensure medication safety for our patients, particularly those multiple complex patients on multiple medications, and also, again, really ensures the highest quality of care is delivered.
So, we have heard so much about shortages of nurses, shortages of rad techs, and so much. Are there any programs that are like pipeline programs for high school students or undergrads that are interested in careers in healthcare?
Sure, yes. That early access to healthcare is critical and essential to building the pipeline. It really helps them, I think, establish or clarify career goals, but it also really gives them practical insights to what it means to be a clinician. So we do have shadowing programs for individuals to explore, many times in partnership with our excellent physicians and staff across our sites.
So if someone's interested in learning more about all of these opportunities that you've mentioned today, how would they get more information?
Well, our external-facing webpage, the LCMC Academic Affairs website, has good information there in terms of the offerings as well as the eligibility for those programs. But I also really encourage anybody interested to reach out to any of our academic partners, but particularly LSU and Tulane. They host a variety of extraordinary programs, both for students interested in healthcare, delivering healthcare, but also in those interested in clinical research as well.
Wow, you've shared a lot of information with us today. So lastly, on this show, we always ask this question of our guests. Recognizing the importance of health and well-being, what outside of work do you do to keep yourself well?
That's the hardest question today, right? I always start with professionally because what I do here is really with the team. Stay focused on the job we do and why we do it. It benefits not just the learners that are here, but also the wider community of New Orleans and beyond, generating healthcare professionals. Personally, still looking for that balance. I can't say that I've mastered it very well, but I do try to refuel at home with my husband and my dog, travel to see 3 adult daughters who live around the country. And then really on my off time, just try to nourish those relationships and have meaningful relationships with friends and family in the New Orleans community.
That's great. Well, thank you so much for joining us today. And thank you for listening. Join us as we go beyond extraordinary on the 4th Tuesday of every month.